I'm Dr. Stacy Chalmers at Bloomington-Normal Audiology, and welcome to I Hear You, where the audiologists at B&A answer your hearing-related questions. Diane in Pontiac wants to know, should every child have their hearing checked, or only if a problem is suspected? If so, at what age and how often? Well, that's a really important question, and actually the answer has changed over the years. So it used to be that hearing was really only checked if there were concerns, and so some hearing losses might go undetected in young children until they're starting to have trouble in school or you're noticing delays in their speech and language. So when that was the approach, by then sometimes it was hard for a child to catch up, and they may have already missed a critical window for developing speech and language. Thankfully now, every newborn has their hearing screened. The earlier we can catch that hearing loss, the better chance that child will have for normal development of speech and language. Sometimes hearing loss can be acquired later, even if the hearing is normal at birth. Some of the common causes for an acquired hearing loss would be maybe a severe head injury, chronic ear infections, noise exposure, certain illnesses like meningitis, and potentially harmful to the ear medications. So if you're having any concerns about your child's hearing, I would say definitely go with your gut. They're never too young to have a test, and as far as how often as you feel is needed, or some children may need closer monitoring. For example, if there's a family history of hearing loss or they're at higher risk due to a syndrome or complication. So when it comes to your child's hearing health, there's no reason to wait, and the earlier you get them tested, the better. Hope that helps. If you have more questions, let us know. I'm Dr. Stacy Chalmers at Bloomington-Normal Audiology, and we're here for you.